According to a recent Centers for Disease Control and Prevention report, 2023 saw the highest number of vaccination waivers among kindergartners ever recorded, with 3% of these students receiving waivers. While the legacy media rushes to connect this statistics to misinformation, could there be something else behind this? Did the federal government's handling of COVID and the Biden administration's overreach with shot mandates, even for healthy young people with no comorbidities, facilitate a distrust of Americans toward vaccines, toward the medical community, and toward government? With me now to talk about this is Dr. Robert Malone, Chief Medical and Regulatory Officer for the Unity Project and an internationally recognized physician scientist who has specialized in advanced development of medical countermeasures to infectious diseases. Dr. Malone, welcome back to Washington Watch. Thanks so much for joining us.
Thanks for having me on, Tony, and talking about these important topics.
Well, let me get your reaction to this, to this rise in vaccine waivers. And of course, the media going crazy about this. It's all about misinformation. But isn't this more fallout from the government's failed approach to the pandemic?
Precisely. I think you have this exactly right in terms of your analysis. And I hate to say I told you so, but this was what I predicted about 3 years ago would be as a consequence of the federal policies and the heavy-handed actions, as you say, overreach. There's such things like the redefining of what is a anti-vaxxer as anybody who is not okay with vaccine mandates, which almost immediately defined a large fraction of the population as anti-vaxxers. This overreach, as you say, has created not just a wariness of federal government policies and messaging, but a re-examination of the whole pediatric vaccine schedule. And it's rare now that I run into somebody, a young parent, who isn't talking about extending the schedule and which of these jabs can we drop.
Mm-hmm. I mean, I'm leery of anything the government tells me now after now looking at I'm actually looking at the facts. It looks like the medical community associated with the government is not doing this, but I'm looking at all the studies saying how wrong they were in their approach. And like you, I questioned it at the beginning. But now, yesterday we were talking on the program, and I said this when I was setting up this segment. We had a alderman who's also a medical doctor from Illinois on the program, one of the suburbs, talking about the immigrants coming into the country, being bussed up there, and the concern about those coming across the border that have no vaccinations, they're carrying infectious diseases, and the government's letting them in, not saying anything about it. I mean, are we not potentially setting up a perfect storm for another health crisis by making people leery of vaccinations, shaking their trust in the government, and then bringing people in who could be carrying deadly diseases?
Well, a lot of the tropical diseases that are potentially coming in with these folks that are coming from Latin and Central America are not on the current vaccine schedule. One of the major potential risks is yellow fever, because we do have the appropriate mosquitoes throughout much of the United States that can transmit yellow fever. But what they don't have is infected people to bite and then spread to others. And we don't have yellow fever vaccine, thank God, on the standard schedule because it's a rather nasty piece of work. But it's deeper than that, Tony. We're talking about potential distributed, because remember, these people are being shipped all over the United States by the airlines and others. We're talking about distributed reach of sexually transmitted diseases, variants of salmonella that are pathogenic. You know, we're all familiar with the risks of diarrhea in using water from Latin America. Fortunately, we have good water systems, good sanitation throughout most of the United States, but we're absolutely creating risk for tropical diseases. And now this is being spun as a issue associated with, quote, climate change, when really what it is a consequence of federal and really executive branch policies.
Now, I know the answer to this question that I'm going to ask you, Dr. Malone, but why are these public health czars not talking about that threat as opposed to wanting to, and I know where they're going with this concern about parents opting their children out of vaccinations. They want to take away those parents' rights, and they want to force them, their children, to get these vaccines. Why aren't they focusing on that threat on the southern border?
Well, Tony, well put. And what it reveals is the subterfuge, or really fraud, that's going on here politically when there's a focus on irrelevant threats or modest threats and a complete lack of focus or addressing clear and present dangers. And that's what we're facing in so many different dimensions with this flood of 3.2 million immigrants at a minimum across the border during 2023. Is a major infectious disease threat in addition to the threats to our social system, infrastructure, jobs, etc.
Dr. Malone, I think we have to be able to trust our government. I think it's important for the whole system to work. I don't trust my government right now with what I've seen. But I want to ask you this. Can trust in these important institutions be restored? And if so, how?
So there is a school of thought that we just need to burn the whole system down. I'm not of that school. I think, as you say, we do need a limited government, a small government. We don't need a bloated bureaucracy and administrative state. And we do, as you point out, need to rebuild public trust. And I think the only way this is going to happen is through accountability. There are individuals who are responsible for what's happened over the last 3 years, and they have not been held accountable, just like they weren't held accountable in the case of a lot of the atrocities associated with the Gulf War and the torture that happened there. There was a decision not to prosecute those people. And in this case, the usual DC attitude of you can never hold the administrative state accountable for their actions needs to be broken. These people need to be ferreted out. We know who many of the names are, and they do need to be brought to court and held accountable for their actions.
I would agree. And not just in this area, but there's several areas that needs to happen.
Agreed.
Dr. Malone, always great to see you. Thanks so much for joining us today.